Good morning. In your health news, it is the peak of cold and flu season. COVID and RSV cases are up too. Now, during this Arctic blast, if you're battling a cold, you can stay in the comfort of your own home and get some help. Joining us this morning is Teledoc physician Dr. Glen Davis. Good morning to you, Dr. Davis.
Hey, good morning. How are you?
I'm doing well. A little bit of a cold, but I'm doing well. You know, as we said,
All right.
it is the peak of cold and flu season. And what is Teledoc, and why is this such a vital tool during winter weather events like this?
Sure. So Teledoc Health is a virtual healthcare company, and we enable patients out there to see a physician in a virtual setting, just like you and I are speaking right now, without go outside. We know that it's cold outside and
Yeah.
certainly a little bit treacherous with the ice. So if you have a cough or cold or any other condition, you need to be checked out. It's a great way to be looked at by a physician without needing to go outside.
Wow, yeah, super convenient. So how do you do this? Is this an app on a phone? Should I jump on the computer? How is this accessible?
We have an app on the phone. We also have a computer website, and sometimes for people who don't have sufficient bandwidth, they can also make a phone call as well. So 3 different
Oh,
ways to reach us. Either way would be appropriate.
Dr. Davis, is Teledoc covered by basic health insurance?
It depends on what your employer has set forth in the health plan. It's something certainly to take a look at within your health plan benefits. But if there's any concern, of course, you can always just simply pay directly to us, to Teledoc, and see a physician that way. But I would say check with your employee benefits and see if that's a covered benefit for you.
Makes sense. Who do you think this is best for? Can parents see a doctor for their little one?
Absolutely. We see plenty of children on our urgent care 24/7 app. Also, I think about, especially weather like this, older adults. Older adults, if there's ice on the ground, they're more likely to break a bone if they slip and fall. So plenty of older adults and really all
Mhm.
points in between. It's appropriate for anyone. And if there's a condition we think, oh, maybe you should go to an actual emergency department or an in-person physician, we're more than likely to say, let's refer you over there as well.
Yeah, Dr. Davis, I'm sure a lot of people accessing Teledoc to see these doctors. Now, do they leave, the appointment with a prescription? Do they get a little medicine? How does that work?
Sure, if appropriate, we can prescribe medicine to your local pharmacy. So if you live in, let's say, Plano, Texas, we can
Hmm.
send it to your preferred pharmacy in Plano, and that's very easy to do electronically, and it can be ready for you, within an hour. So absolutely a great, I would say, option for anyone in the Dallas-Fort Worth area.
Awesome. And once again, Dr. Davis, with Teledoc, do you have to set up virtual appointments?
Yes, and you can set them up in advance. You can set up a certain time throughout the day, or you can just walk in and get in line, walk in the virtual waiting room and get in line. Typically, our wait times are less than 10 minutes, so it's different than what you would typically experience in a brick and mortar physician, and certainly have practiced in that environment for many years. But yes, typically less than 10 minutes, so it's really very convenient, and again, accessible from the comfort of your own home.
Yeah, especially if you're hardworking, you don't have time off. It is very, very convenient. Dr. Davis, thank you so much for joining us this morning. Great resource.
Oh, it's my pleasure. Thank you.
All right.